Great. So, hi everyone, welcome to this webinar. It's great to have everyone here. Thank you for being here, and I hope we can all have a great, productive conversation. I hope everyone's safe and well, first of all, and I hope you can hear me fine. But I want to take this time to introduce myself. I am Asmita. I am a master's student studying women and child abuse, and you might recognize me from the Talking Research podcast, where I interview academics and researchers who study sexual violence. The aim is to make their work accessible to those who wouldn't otherwise engage with it. So, and to make their work part of the mainstream conversation in sexual violence. So, to have more such conversations. Now, the podcast completed a year last week, and we're 25 episodes old, which is very scary, but it's a great milestone, and we're here to celebrate that, and we're here today to talk about something that's very urgent, something that's very relevant to this point in time, which is gendered and sexual violence during the pandemic. Now, just some housekeeping before we begin. Um, like I said, the session will be recorded and posted on YouTube and Facebook later. So if everyone in the audience can make sure your mics and cameras are off all the way through, and it might be better to switch to the speaker view as well. And second thing, and importantly, we are going to be talking about sexual and gendered violence today. So if this is something that you find disturbing, please pop out at any minute. It's very understandable, and we won't mind at all. Now, since lockdowns were implemented to tackle the coronavirus around the world sometime around March, reports and estimates of cases of gender-based violence have risen. Now, this has been referred to as the shadow pandemic. So there's this assumption that if we stay at home, we're safe, which, while it's true for the virus that spreads through infection, it's not true for those who are being abused at home or who are being abused as essential workers and so on. Now, I just wanted to show you um, this great brief that UN Women put out. I hope you can see it. Um, just some stats on what's going on globally. 243 million women and girls between the ages of 15 and 49 have been subjected to sexual and or physical abuse perpetrated by an intimate partner. So, um, they're people they're in relationships with in the past 12 months. And this number is likely to increase as a society we go through a lot of stress, and there's a lot of tension and fears as economies collapse, and the fallout from this pandemic. Now, there's some stats on France, Cyprus, Singapore, Argentina, Canada, United Kingdom. So basically all around the world, we've seen a steep rise in reports and estimates of sexual violence and domestic violence and child abuse. So it's really frightening, it's really scary, and these numbers are likely to be higher because most reports of sexual violence and domestic violence are an underestimate because most survivors don't report. Now, I'm just going to stop sharing my screen. Um, So at this point, I'm really glad that we're joined by two gender-based violence experts who will talk to us about these themes today. And I'm just going to introduce them just now. So we have Dr. Nicola Henry, who is an associate professor and principal research fellow in the Social and Global Studies Center at RMIT University in Melbourne. And in her interview on Talking Research, Nicola shared research on image-based sexual abuse. So how technology facilitates sexual abuse. So something very relevant to what we're talking about. And we're also joined by Dr. Sreeparna Chattopadhyay, who is an independent researcher based in the Netherlands. She has over 15 years of research experience in gender, health, and education across academia, nonprofits, and government institutions. In her talking research interview, Sreeparna shared her research on sexual coercion and rape in marriage in India. So both their fields of expertise are something very relevant to what we're going to be talking about today. And I'm really delighted that they could be here. So, how this conversation will go is we'll have some questions for them at the start. That there'll be a normal conversation, and then after that, they'll be open to audience questions. So please send in your questions in the chat, and we'll take them at the end. So to start, I want to go to Sreeparna first. Um, Welcome to both the guests. Thank you for making it. And going to Sreeparna first. So, a very broad question for you. You've researched sexual coercion and rape in marriage in India. And I just want you to walk us through some of the risk factors for women and children in abusive households during the various lockdowns and what we know about what's happening inside homes in lockdown.
Yes, so, Asmita, as you rightly pointed out in the beginning, home is not a safe place for women and children who have been abused in the past or are currently being abused. There is an increase in stressors as it happened during the COVID-19 lockdown because of loss of employment and also the overall situation of pandemic, the way in which the lockdown was handled in some countries with not enough notice for people to move from wherever they were to a safe place. So all of these would have multiplied the stressors that they were already experiencing even before the pandemic. So one thing I want to make sure that there is consensus on is that we have enough evidence now to show that COVID-19 did cause an increase in domestic violence around the world. So it's not, and it is what we would call a complex health emergency, a humanitarian crisis. So, and in many situations of humanitarian crisis, we see this kind of, increase in gender-based violence, and that's happened with the Ebola pandemic as well as other kinds of humanitarian crisis in conflict areas, etc. So, so women who could work and leave the abusive household for some time, obviously that was, that option was cut off because of work from home options or because many women lost their jobs during the pandemic because of social distancing measures. More women tend to work in professions where social distancing cannot be implemented compared to men, and so in the hospitality industry, in salon, etc. So that was that I think is something worth thinking about. And secondly, even with provisions of formal services in countries where such services were available, access became difficult because of restrictions on mobility. In a country like India, our research has shown that uh, only 31.37% of women who experience what is classified as severe domestic violence ever share it with family and friends. And in a situation of lockdown and restrictions of mobility, those kinds of informal support mechanisms of going to a native family or visiting a friend would have been extremely limited or absent, especially if, for example, you were in a red containment zone in India. So all of this, putting together means two things. A, you have increases in, domestic and sexual violence. And B, you also have a complete reduction in service provisions where women would have naturally sought support during non-pandemic times. So yeah. Oh, and one other thing I wanted to mention is that with regards to children, in many countries, schools are sort of safe spaces where teachers and and school authorities can always pick out if a child is being abused or neglected, and involves social services. So with schools being shut in many countries around the world, again, that kind of support system for children was lost. And they are also, they are especially vulnerable, given that their support systems are even weaker than adult women.
Yeah. Thank you for walking us through that and really terrible statistics and, um, you know, red containment zones, I just want to say, are zones in India where there's a bigger outbreak, so they have higher restrictions on movement. And yeah, I want to go to Nicola next, and just a broad question again. What do we know about tech facilitated abuse during the pandemic? Just, a really broad general idea.
Yeah, thank you so much, Asmita. And yeah, I guess I just want to echo what Sreeparna has mentioned about the increasing reports of various forms of gender-based violence, including domestic violence. And then what I'll be talking about is in relation to technology-facilitated abuse. I might just start by explaining what I mean by technology-facilitated abuse. And there's so many different definitions out there and different terms that are used. Another term that we've used in our research is technology-facilitated sexual violence, but there's also online abuse, online violence, and a range of other terms. But I'll use the term technology-facilitated abuse. It's a bit of an umbrella term to describe harassment, for example, online sexual harassment, surveillance and stalking, hate speech, threatening messages, impersonation, doxing, restricting access to technology, cyberbullying, child sexual exploitation, as well as image-based sexual abuse. And as you mentioned in your introduction, a lot of the work that I've been doing has been focused on technology-facilitated sexual violence, but it has focused on image-based sexual abuse, which refers to the non-consensual taking or sharing of intimate images or making threats to share those images. So essentially we're dealing with a range of different behaviours. Some of them may be less relevant during lockdown, some of the contact offences, for example, where digital technologies like dating apps are used to set up a sexual assault or a rape in person. But of course, we are seeing a lot of, as Sreeparna mentioned, in relation to domestic violence. And I'll talk a little bit about technology-facilitated domestic violence very shortly. The other category, I guess you could say, is image-based violation. So that includes the image-based sexual abuse that I spoke about previously. And the third category is text or speech-based harms. Now, there's still little data available on how much these behaviours, this kind of whole range of different behaviours, have increased due to the COVID-19 pandemic. But I can just tell you there are a number of governmental agencies, for example, around the world that have had increases in reporting from victims who've had these experiences. So just to give you an example, I'm in Australia. The Australian E-Safety Commissioner, in their latest report, they said that there was a 255% increase in image-based sexual abuse reporting. That's huge, 255% increase compared to the previous year. They also said that they've had a 96% increase in harmful online content, and that includes child sexual abuse material, a 19% increase in cyberbullying, and also 35% increase in adult cyber abuse reports. And these kind of similar trends have been reported by other agencies throughout the world. So for example, the UK Revenge Porn Helpline has reported a 22% increase in the reporting of image-based sexual abuse. It was not quite as high as the 255% increase in the Australian context, but what it does show us is that we are seeing these behaviours on the rise. And I might just point out to you as well, there was a study that was, some results from a study that were released, I can't remember if it was early this week or last week. Time is just completely crazy at the moment for me in strict lockdown. but there was a report released by Plan International that surveyed just over 14,000 girls and young women about their experiences of online harassment. This was carried out in 22 countries around the world. And they found a high rate of girls and young women had experienced online abuse and harassment. So I think they found something like 59% had experienced that. And they actually found really high rates in Australian context. So 65% of girls and young women in Australia aged between 15 and 25 had been exposed to online violence and abuse. So we are seeing increases. Sreeparna's mentioned about increases to domestic violence as well. And I should just mention that the examples that I've given of technology facilitated abuse, we are seeing this happening a lot in domestic violence context. So for example, perpetrators sending harassing messages or images, stalking and surveillance, image-based sexual abuse, particularly the threat to share nude or sexual images in order to coerce the victim into engaging in an unwanted act or to prevent them from leaving the relationship or seeking help. But also we see perpetrators restricting access to technology and using technology to access and control devices as well. So unfortunately, with the increase in domestic violence, we also have an increase in technology facilitated domestic violence as well.
It's great that you point out how these different forms of abuse are interlinked. So, it's not that if there's domestic violence, there won't be image-based abuse or, online abuse or sexual abuse. Often these acts of violence are interlinked, and that's something we need to think about when we talk about violence in these contexts. So thank you for pointing that out. I wanted to ask you, what does doxing mean?
Doxing is where personal details of a victim are released. So for example, on some websites, for example, where images are shared, like non-consensual nude or sexual images, where those images are also accompanied personal details of the victim. So it might be their name, where they live, where they work, their age, and other details.
Right. So violation of privacy, and the effect is often to make the victim feel unsafe, and
yeah, because that information is accessible to strangers as well as the perpetrator who's sharing those details, and so it just creates that vulnerability, but it also increases the shame because particularly when we're talking about images, and then there's also the identifying information that's attached. So the victim then becomes more searchable online if those details are provided to potentially millions of people online.
Yeah, and that potentially leads to further harassment.
Yeah, and I just wanted to add there, I think that's a really important point, if you don't mind, that when we're talking about online abuse and harassment, there's a complexity, and this is, it's similar to kind of non-technological forms of domestic violence as well, where you might see other family members joining in on the abuse or supporting the perpetrator. You might see friends and police also, siding with the perpetrator. But in relation to online abuse as well, you may have the original perpetrator, but you also might have so-called bystanders who join in on the abuse and harassment. And people sharing intimate images is an example of that, where you've got the person who originally shares the images without consent, but then you've got all the people that are joining in on the sharing of those images. And you also have the complicity of the digital platforms as well that are hosting these images. So it does point to the complexity of this issue around technology facilitated abuse. And I think I know we're going to be talking about this today, but it does point to what's needed in relation to very complex response from governments, from digital platforms, from support services. And I think the COVID-19 situation is really showing us how complex these issues are, and how they've become exacerbated, like they've become worse and increase during times of crisis.
Yeah, I think it's really interesting what you said about how family members or other related or other members of public join into the abuse, because Sreeparna and I come from India, and joint families are are sort of how the societal family structure is how the families are structured in India. And I want to go back to Sreeparna now, and you've you've researched how access to healthcare is for marital rape survivors in India. And related to that, I want to ask you, what do we know about access to healthcare? So, non-COVID related access to healthcare. So, for example, marital rape survivors who are seeking for healthcare, for seeking treatment. What do we know about how that has been disrupted? And I mean, it's while we talk about sexual violence in India, it's something that needs to be said that right now we're all grieving what's happening in our country, and caste-based sexual violence, something we spoke about before we started this session. There's been a slew of caste-based very gruesome reports of rapes in one particular state, but they're likely to have been more. Just wanted to give that context. But yeah, tell us about that, Sreeparna.
Okay, so before I answer your question, I just want to sort of talk a little bit about data, because I think that one of the things to point out is that in many low and middle income countries, which is the bulk of the countries around the world, the data sources are not very robust. So what we are seeing in terms of reports coming out, especially reports that have been published by journalists and some of these international surveys, one of them Nicola mentioned, there are also surveys by Planned Parenthood which are going on right now, which I will make a reference to when I talk about disruptions in healthcare access for survivors of sexual violence, is that we don't have very reliable data sources, right? So there was, in India, for example, there was one WhatsApp chat number which was instituted by the National Commission for Women for Domestic Violence Cases. And initial newspaper reports found that in the first 4 phases of the lockdown, that the number of calls which came to this WhatsApp line was more than what has been historically recorded in the last 10 years. And when we hear of these kinds of numbers, you're often left wondering, did it actually lead to a very rapid increase in violence, or is what happened was that this number was made available and therefore more women were able to access it? And I would say that given what we have seen around the world, from where, and especially from countries from high income countries where data sources are much more robust, that there has been a steep increase in violence. But I think that we will need to wait until the next year to see what has actually been the fallout in terms of numbers, when proper data collection will become possible. Now, to answer your questions in terms of healthcare disruptions, survivors of domestic and sexual violence need an array of medical, psychological, and legal services. And under strict lockdown, most of these have been unavailable, even when certain services like abortions were marked as essential services by government. So the government of India, for example, marked this as an essential service, which was great. But then in the strict phases of the lockdown, you had restricted mobility. You also have a situation, for example, when it's the pregnancy may not be related to, may not be an outcome of non-consensual sex, but could be just unplanned or unwanted. And in that case, it has been difficult to get abortion pills. So there has been, I'll just give you some global numbers, because one of the fallouts of sexual coercion or non-consensual sex, or even unavailability of contraceptive products which have happened because of disruption to supply chain in many countries around the world, is a steep increase in unplanned pregnancies and unsafe abortions. So there's been a big study conducted by the Alan Guttmacher Institute, and they made some very frightening estimates of the impact of COVID-19. And this was early, even before, I think sometime in April, when the study was released. And they found that even with a 10% reduction in services, and mind you, this is just with a 10% reduction, in most countries around the world, there has been a much greater reduction than that, especially in low and middle income countries. 49 million women's contraceptive needs will not be covered. There will be 15 million unintended pregnancies as a result. 1.7 million women will give birth to 2.6 million newborns who would experience health complications from closely spaced pregnancies, leading to an additional 28,000 maternal and 168,000 newborn deaths. And there will be many unreported deaths as well, which are linked to unsafe abortions. And they estimated that with contraction and safe abortion services, 3.3 million women might have unsafe abortions, leading to a further 1,000 maternal deaths. So the implications for these kinds of disruptions are huge for women's health. So one is access and mobility. The second is disruptions to the supply chain management. Third has been the diversion of resources in terms of medical personnel, right? So most of the physicians are understandably exhausted, overworked. They have been diverted to COVID-19 related work. So finding finding gynecological support, or a gynecologist who's willing to do abortions or give sort of medical care in cases of sexual violence that have become difficult. Even before the pandemic, the one-stop crisis centers in India were in a complete state of disarray, to the extent that one study in the EPW, the Economic and Political Weekly, which was, you can find this on the website, found that in the 2019 budget in India, the amount of money that was allocated to the one-stop crisis centers have been reduced greatly because it was not spent in the previous year. So it seems mind-boggling that for a country which is, experiencing epidemic proportions of gender-based violence, caste-based sexual violence, that there is no money, that there is money available, but that money is not being spent on services. So in countries where you have this kind of poor infrastructuring, even prior to the pandemic has just exacerbated problems and made things worse. So finding care for women, children, and adolescents who are affected by gender-based and sexual violence is going to be a major challenge, and has been a major challenge throughout the pandemic as well. In high income countries, so I live in the Netherlands right now. So there, the rule is that a woman needs to visit an abortion clinic before she can get the pills for a medical abortion. Now, for women who are self-isolating because of a contact with a COVID-19 positive patient, this has not been possible. So in fact, there have been women's organizations in the Netherlands which are lobbying to change this law so that in England, they can provide abortion pills through telemedicine, but that's not possible in the Netherlands. In Romania, for example, abortion was not even declared an essential service. So therefore, many women could not access it. So I think that there will need to be a lot of thought on when you have a complex humanitarian crisis like you have with the COVID-19 pandemic, and you also have all these pre-existing inequalities at various levels, and you have an inadequate health infrastructure, or you have laws which have not taken into account what happens with stay-at-home orders or restrictions on mobility, then you're going to have a situation where you will just, have a lot of, survivors who will not have access to the care that's really needed. And the third aspect of it, which is access to judicial services and legal services, which is also a right for victims of and survivors of sexual and gender-based violence is probably non-existent in many countries around the world because judicial services have not been digitalized. So you don't have like video calls for. There have been instances when this has happened in India, but I think largely given how overburdened the Indian judiciary is, and in many low and middle income countries around the world, that will become, that's going to be a problem. So when the pandemic finally sort of ends, when once we have the vaccine, hopefully sooner than later, there will be a huge amount of work to do in terms of providing medical care, psychological care, and access to justice and legal services for victims of sexual and gender-based violence.
Yeah. And I remember when we spoke in April, when we recorded your interview for the podcast, you said that the fallout from COVID-19 is going to be that funding to women's health and funding to, post-sexual violence healthcare, all of that is going to be reduced, especially in low-income countries, as we try to tackle this current pandemic.
Yeah, and I think that's already happened at some level, and it will continue to happen because in places where the economy has contracted and where even access to care for non-COVID-19 related problems is problematic, right? So now when sexual and reproductive health in many countries around the world don't really see it as an essential service. So the urgency with which we as sort of researchers and people who are interested in women's and children's health would tackle these issues, that's not been the case. And we have seen this in the case of other pandemics as well, when women's and children's women's sexual and reproductive health needs and children's health needs also kind of fall on the wayside because of the impact of these pandemics. So I think that I don't think that we have kind of numbers right now because it's too early to tell whether this has happened, but given the precedents that we have of the past, I think this is bound to happen, combined with all kinds of conservative forces that are gathering around the world in trying to intervene against women's reproductive health and rights in the United States, in Brazil, in Philippines. So I think we will definitely see a contraction of services.
Yeah, thank you for also pointing out how access to reproductive health, reproductive health care, how that's linked to this fundamental autonomy and safety for women, and how when we talk about lack of access to safety, reproductive freedom is essentially linked to that conversation. You spoke about children just now and safety of children, and here I want to go back to Nicola because we've seen with how we adapt to coronavirus, we've seen Zoom schools and more and more children going online. What do we know about sexual exploitation, child sexual exploitation that's going on online just now? There have been reports that child sexual exploitation is on the rise. Tell us about that.
Okay, yeah, thank you. Look, I have to be honest, it's not my area of of expertise. So I mainly focus on technology facilitated abuse in relation to adults. Well, not exclusively, but I am aware of some of the trends that are happening around this issue. So I'll just give a couple of examples if that's helpful. In the Australian context, again, we're seeing massive increases in child sexual abuse material. The Australian Centre to Counter Child Exploitation reported an increase of 122% during the April-June 2020 period in comparison to the same period last year. So huge increase there. According to the UK charity Internet Watch Foundation, the IWF, they've also reported a massive increase. They say a 50% increase in reports of child sexual abuse material that have been received during the lockdown period. they've also said that the IWF that they're actually finding that a lot of I think nearly 50% of all the child sexual abuse content that they deal with is actually self-generated material. So what that's suggesting is that perpetrators are manipulating children into creating their own abuse videos. So through webcams, for example, sometimes in the child's bedroom, which are then shared with the perpetrator online. So there are some really disturbing increases, and it's important to also reflect on, you know, the perpetrators. There's also reports of that, I mean, I don't have the statistics or anything on this, but that some perpetrators of child sexual exploitation are new to the child abuse offending. We've also heard that in relation to domestic violence, where people who haven't previously perpetrated domestic violence, but during the COVID-19 period have started to offend for the first time. So that's a real challenge for addressing this issue, because not only does it mean we've got increasing numbers of people engaging these behaviours, a lot of victimisation happening, it does present some challenges in terms of detection and in terms of responding as well. So that's about, yeah, that's kind of like where the trends are going. And I think just going back to perpetration as well, I think that I've got a criminology background, and I won't get too academic for this webinar, but I do want to just kind of mention there's this theory in criminology called routine activities theory. It's been highly criticised for a whole bunch of reasons, which I won't get into here. But what the theory says is that there are three factors that are said to affect the extent of the crime and the location. So they say the presence and proximity of likely offenders who are motivated to commit the crime, the absence of capable guardians to intervene, and the third factor is the availability of suitable targets. So this is to some extent useful for understanding the COVID-19 period and the increases in online abuse and harassment, including the increases in child sexual abuse material that's been circulated online. So basically, you know, we have a situation where there's a lot of children who are online a lot more. Like I can say with my son, who's been doing remote learning at home for the past 7 months, he's been spending way more time on the screen than he ever has in his entire life. And so that's obviously the case with a lot of children. So there's more opportunity for motivated perpetrators to target children who are online for their schooling or playing online games with their friends when they're not doing their schooling. There's also the absence of those capable guardians to intervene, even though, of course, there are people in the community reporting child sexual abuse material offences, and there are obviously police and law enforcement efforts to intervene. So we do have a little bit of that. But I think, you know, the COVID-19 situation is really problematic because it does increase the opportunities that those motivated perpetrators will have to contact and target and groom children.
Just wanted to ask you really quickly what that can look like, you know, what are some of those behaviors that, or like what should we look out for?
Again, I'm not an expert on this issue, unfortunately, except to say, I think, as I mentioned before, that there are some changes in the types of material that's been circulated. So the one example I gave before was where children are groomed into creating their own content. And I think that's a really disturbing new trend, well, not new trend, but it's a disturbing trend that's on the rise. And yeah, unfortunately, I can't speak any further about some of the other behaviours, but I mean, I guess there's I'm not sure, I'm sorry.
But thank you for answering that. Now I've got a general question for the both of you, which is, as Sreeparna said earlier, this is something we've seen in the past, perhaps not on the same scale, but there are precedents of, you know, sexual and gendered violence and child abuse going up during public health crises. So, you know, during the 2013 to 15 Ebola outbreak in West Africa, gender-based violence rose. So going forward, do you have any recommendations for how states can tackle this violence during this current pandemic? And Sreeparna, should we start with you?
Sure. So I think that this question should be something that should have been at the top of people's heads when they were planning for the pandemic, to the extent that planning a response was possible or was done in many countries, because I think the pandemic response in and of itself has been really inadequate in many countries around the world. So as I mentioned before, there are several health consequences related to sexual and reproductive health related to gender-based violence and sexual violence. And right in the pandemic planning response stage itself, there should have been gender awareness built into the operational responses. So the questions like, where are the women? Who provides most of the care? And how is this done in this particular context? Who is dying? Who is surviving? And why? So something that you already see that's happening before the pandemic, and how that might get sort of exacerbated during, for reasons which may or may not stem directly from the pandemic itself. Who are the community mobilizers? What kind of needs do they have, and how can they be sort of included in the pandemic response as well? And I say this because most of the community mobilization in low and middle income countries are done by frontline health workers. They are called accredited social health activists in India, the ASHA workers, but they are not treated well. And there have been many newspaper reports of them being abused and humiliated, and even being subjected to physical violence when they have tried to do contact tracing and enforce rules of quarantine for affected patients. So the community mobilization part of it, which should have included women right from the beginning, did not happen. So there has been an overall lack of attention being paid to sort of both the gendered consequences of the pandemic, as well as embedding gender into the pandemic response, right? And the fact that women's concerns have not been taken into account at all levels, and not just women. I should also mention the LGBTQIA community as well, because when you asked in the beginning about home not being a safe place for many LGBTQIA communities, also home may not be a safe place, right? Especially if they have not come out to their parents, or if they have an antagonistic relationship with the parents because the parents don't approve of their gender or sexual orientations and identities. So that group also has been kind of left in the lurch. So in terms of recommendations, I think since none of this has happened, so going forward, what can we do? I think one thing is, I would say, collect data really robustly, really thoroughly, to see what has happened, because I think one of the ways in which you can respond more efficiently is if you knew what's happening, where, when, why, how, all of that. The second thing is that, wherever supply chains have been disrupted, wherever you've had problems with accessing contraception, abortion services, psychological care for survivors of sexual and gender-based violence, all of those services need to be restored. And to some extent, technology can facilitate it, because you can do it through phone, even when there isn't online access. So phone-based counseling can be provided, but for that you need to have adequate resources in place. And even that minimal amount of resourcing had not been done in many places prior to the pandemic, right? So post-pandemic, if this is an opportunity for us to actually look at the problems that this pandemic has made visible, because I think one of the good things that has happened is there has been an explosion of newspaper articles and digital articles and all kinds of discussions about the shadow pandemic or the hidden pandemic. I haven't seen so many articles on domestic and sexual violence come out in the last year or so, as it has happened in the last 6 months because of the COVID-19 lockdown measures. There has been an increasing attention being paid to it. So I think that's a really good step and a step in the right direction. So if we can continue, working with grassroots organizations and governmental agencies wherever they're working with survivors and supporting them in whatever way we can, I think that would be really good, because as a community of scholars, practitioners, people who are allies, gender allies, I think all of these groups, we need to come together to actually help, because I don't know how much is possible to do just by governments alone. I don't have a lot of faith that governments alone will be able to handle this, the fallout on their own.
Nicola?
Yeah, thank you. I mean, I would like to just say I agree with all of the key points you made, Sreeparna, about the things that need to be done, but also some of the limitations around governments acting alone to address this very complex issue. I think that really what we're dealing with here, I mean, pre-COVID-19, we have huge inequalities, social inequalities around gender and race and class and disability and sexuality. And so we have these pre-existing social inequalities that have been made worse, I guess, in some ways during the COVID-19 period. So it's really about addressing some of the gender inequalities is incredibly important. And in relation to the digital stuff, the digital divide is a really significant issue, where 50% of the world's population don't have access to digital technologies, and where women in some countries have less access to digital technologies than their male counterparts in some countries. And so we need to address that problem, and I think the COVID-19 experience is kind of highlighting that is a huge problem that needs addressing. But of course, and I've already mentioned some of the examples around technology facilitated abuse, is that for those who do have internet access, the experience of technology facilitated abuse can be incredibly harmful. So it can result in a person changing their jobs, changing their identity. It can be mental health oriented issues around traumatic experiences, anxiety, depression, post-traumatic stress disorder. But then of course we also have the more kind of extreme ends of that spectrum, where some people are engaging in self-harm or suicide when they've had these experiences. So there are significant impacts, and what happens as a result of technology facilitated abuse is that for many women, for example, particularly women of colour or women from minority backgrounds who are targeted more on the basis of their gender and their race and their ethnicity and other factors, is that it may push them out of careers that are public facing, like journalism, politics, for example. And so, or for many victims of online abuse, it means that they remove themselves from social media so that they're not subjected to that abuse. So I think it's important to take the serious impacts of technology facilitated abuse and gendered violence more broadly seriously. And I think one of the key things that there's an opportunity at the moment is to raise some more attention around the harms and the impacts of both gendered violence and technology facilitated abuse. And I think part of the problem is that a lot of people don't take online abuse very seriously. They see it as something that's less than real life experiences of physical violence, for example, and they fail to understand the significant impacts on people's lives. Sreeparna's done a brilliant job of explaining about the lack of resources for victim support services in relation to domestic and sexual violence and reproductive rights. That's absolutely essential, is that at the moment providing information and support services for victims is crucial. And also in Australia, there's the support services are absolutely overwhelmed, and the mental health services are likewise overwhelmed with increasing numbers of children seeking mental health support. There's also increasing numbers of children on antidepressant medication to deal with some of the fallout from the COVID-19 pandemic, and of course perpetrators as well. And I think that's, you know, mental health, you know, the obviously is not the cause necessarily of domestic or sexual violence, but it does play a role, as does alcohol abuse and as does financial insecurity for perpetrators. So those factors all need to be taken on board. But I think this is also an opportunity for police and victim support service not only to be well resourced, but to be able to understand that there's awareness raising around the experiences of, again, both technology facilitated abuse and gender violence more broadly, to be able to respond to the incredibly vulnerable the incredible vulnerability of many people in our community. I also wanted to pick up on something Sreeparna mentioned as well, which is around the vulnerability of particular groups of victims. So the targeting of some of those groups, Indigenous people, for example, LGBTIQ people with disabilities, racial minorities and ethnic minorities. And I think that that's something that is really important to the question around diversity is really important in terms of understanding the harms, understanding the experiences, but also providing the supports to victim survivors as well. And I guess I just want to kind of end by saying it's really what I began with when we started this webinar, which is this is a highly complex issue. Whether we're talking about gendered violence, or whether we're talking about technology facilitated abuse, and what it requires, and I think it really nicely picks up on Sreeparna's voice, key point at the end around governments, you know, are ill-equipped to respond to this issue. And I think what's needed is we do need government to respond. We need better laws in place to address these issues. We need better human rights protection. We need governments to support these agencies to be able to provide the on-ground support. But we also need to pay attention to digital platforms and corporations and some of these broader structural problems that we have in our society around capitalism, patriarchy, racism, and some of these broader issues that also need to be tackled. They needed to be tackled pre-COVID-19, and they certainly, just as a reminder during the COVID-19 period, that we do really need to address those issues. And just as an example, I guess the digital technologies themselves, the people who are designing the technologies are often white, male, elite, heterosexual men who are designing the technologies, designing the response to the technologies. And I think there's a lot of racist and sexist bias that's appearing in some of these digital technologies. And so again, COVID-19 is an opportunity to pause and to address some of these fundamentally deeply embedded issues that we have around difference and we have around diversity. And so I think we really do need a whole of community approach to dealing with these problems. And unfortunately, you know, this is a really, really tough year, and it's very tough for a lot of people. And I just hope that the people with resources and people who have the capacity to address this problem do take notice and do something about it.
Yeah. That's a great point, that the state response alone won't change anything. We'll have to be a community-wide approach, so it comes down to all of us. I'm going to be looking at the chat now, and there's a question on doxing. So is doxing becoming a common form of abuse given the tech regulations in place? I think that's for you, Nicola.
Yeah, I posted something on that. I wasn't sure whether I was meant to respond to the chat, but I just put some information. Again, it's in the Australian context, but it just provides some more information about doxing and some of the trends that we're seeing with COVID-19. I'm not sure, again, this isn't my specialty in terms of my expertise around doxing. And there are different forms of doxing. There's different, I mean, sometimes it happens in relation to kind of public interest cases where someone's, you know, providing some information to expose a public issue of some sort. But as I mentioned earlier, in some cases it's information's being disclosed, private information's being disclosed about victim survivors of domestic violence or of sexual violence. But I unfortunately don't know what the numbers are, whether it's becoming more common.
Yeah, and I imagine it's also hard to measure, some of these forms of abuse, seeing how they evolve almost daily.
Well, yeah, I should actually just mention too, I mean, yes, that's a really good point, because when you do a survey, for example, you're asking, for example, people whether they've had an experience before, but sometimes people won't know that someone has doxed them, that someone else has provided information about them online. And the same way with image-based abuse is, for many victims, don't know that another person is sharing intimate images of them online or amongst a group of friends. And so some of the statistics around some of these behaviours are not always known it may be an underestimate, because the victim doesn't always know that someone else is carrying out these behaviours online.
Yeah, great point. And there's, again, in the chat, both Nicola and Sreeparna have included links to the studies that they spoke about, so great resources. And there's another question on, do we have statistics on sexual violence against transgender people during the pandemic in India? Sreeparna, if you want to take that.
I am not sure, but I'm sure that there are organizations which are working with trans people around in different cities in India, which may have kept these kinds of records. So perhaps not digitally available, but maybe something that may be available if you chat with members of these organizations. And there's one thing which Nicola mentioned, which I wanted to echo, and I thought that, her sort of synopsis of the kind of technology facilitated violence, abuse that we've been seeing during the COVID-19 pandemic was brilliant. But it's that you do have both things happening. So for example, in India, there are these rape videos which are circulated and sold, right? You might have heard about it, where you have offline violence taking place, and then to further shame the victim and blackmail the victim, you have things being not just to shame her and blackmail her, but also to make a profit out of it, right? So for 25 rupees, for 30 rupees, for very small sums of money, in many tier 2, tier 3 cities, you can go to a small shop and you will be able to buy these videos. So there is kind of a spectrum of where you have the actual abuse happening, you have the recording of that abuse, and then wide distribution of that abuse as well. And with regard to doxing, one thing that I was reminded of is that even prior to the use of technology, which has made mass distribution possible, if someone wanted to be really nasty to you, you could, write the phone number of a girl on the toilet, bathroom door or any public place, and, put a really horrible, like vulgar message beyond it. And then that girl might end up getting lots of people harassing her on the phone because someone who had her phone number just made it widely available. So I think what technology has made it possible is just all of this stuff happening on a much more massive scale, in newer ways, in more insidious ways, and in ways that has made discovery a little bit more difficult. So as much, so we need, sort of an approach where we have legal services, but we also hold the technology companies accountable and stop, hate speech or sort of misogynistic comments and comments of that nature on digital platforms and social media.
Yeah, there's a comment on this, I think something related to this in the chat from Soumya, who says one of her friends had a similar experience in a classroom in India where perpetrators would join the online classes somehow and shared their web images. So most of the children were exposed to this because it was one of the usual classes and the guardians weren't around. She had to remove the person from the group, but that's the only thing they could do. Schools aren't really prepared to deal with online abuse and haven't really provided the staff with resources and skills to deal with the same, which is, yeah, really important point.
Did you want me to respond briefly to that?
If you have anything to say.
It's more a personal experience, actually. I think that's a really interesting comment about schools not being very prepared to deal with some of these problems. I certainly know with the school that my son's at, it's a primary school in Australia, we haven't really had much information about cyber safety and cyber security for children. One of the things with children being at home working, I mean, I'm not sure what the situation is in India at the moment around lockdowns and whether there's a remote learning happening across the country, but certainly here in Victoria and in Australia, in Melbourne, we've been in lockdown for about 7 months now, where kids, school children have been working from home, aside from 2 weeks in June. And unfortunately for a lot of parents who are working full-time, they can't always keep track of what their children are doing online. And, you know, some of the kids are playing these online games where perpetrators can, you know, join in and befriend children. And this, you know, there's been nothing from our school, for example, to kind of give us some guidance on how to deal with those issues. And arguably, you know, the schools are already under pressure from the COVID-19 pandemic and shifting to an online learning model. We do have the Office of the E-Safety Commissioner, and they do provide really good advice about for parents and for schools around how to tackle this issue. But certainly as a parent, yes, it is a challenge. And I said to my partner earlier today that we do need to spend more time working out what we're doing in relation to our child's cyber security.
Yeah, there's such a terrifying aspect, isn't it? Something that we never thought we'd have to think about. But like Sreeparna said, it's something that's now possible on a mass scale because of technology, which is just scary. But yeah, I think that brings us to the end of this conversation. And thank you to everyone who joined. Thank you to everyone in the audience. But thank you especially to Nicola and Sreeparna for making the time and for sharing their insightful research with us. Again, links to their episodes are in the chat, so you can listen to those, and this episode will be on YouTube. So if you want to share it with someone who you think might be interested, please do. And I think that's everything from us. Thank you, everyone. Thank you, especially Nicola and Sreeparna. It was great to have you guys.
Thank you so much.
Thank you for inviting us.